Go.
Hey Jennifer, how have you been?
I'm great. How about you?
Good. I just got a new job, working at Tri-County Hospital as a nurse.
Oh, how's that been going?
It's been going really well. No issues.
Awesome. How long have you been there then?
Just a year. Not very long.
Seen anything interesting? Just every day?
The same old stuff. Really.
What unit do you work on?
Working at ER.
Oh, that sounds exciting.
Mm-hmm.
You guys go over your skills a lot? Practice a lot of CPR? And
You know, we don't really practice a lot of anything. You know, they just kind of think that I should know how to do everything. You know.
Oh, that's always scary. You never know what you do if somebody showed up.
Hey,
and
How
had a
are you?
problem.
I'm having a piece of gum. It was nasty taste in my mouth.
Oh God. Are you okay?
Oh my gosh. Do you know
Breathe.
what do we need to do?
We're not at the hospital.
Isn't there a law that covers us?
What
The
is
Good
it?
Samaritan law?
Oh yeah, the Good Samaritan law. But as long as I don't do any kind of invasive procedures, will you call 911?
I will.
I'm just gonna do the Heimlich maneuver so I don't get sued.
Okay.
Okay.
All right.
1, 2.
Oh gosh.
Oh,
I thought I was gonna die there.
Man.
Thank you so much for
Good.
helping me.
You're welcome.
Yeah.
How do you feel?
A little bit. Still got, a little bit of a cough, but I think I'm gonna be okay.
Yeah.
That scared me. I'm
Yeah.
out of breath
I
though.
don't think you're gonna sue me or anything. Did I hurt you or anything?
My rib is kind of hurting.
Is the Good Samaritan law gonna
Good
cover me?
Samaritan law should cover you because you weren't doing anything
I was
that.
only trying to help.
Ah, that is true. I'll have
Just
to
trying to-
contact my lawyer and we'll just have to see.
Okay. Do you think what things do you know about the Good Samaritan law that'll cover me?
Well, it says that if you are rendering care during an emergency or in an accident and you are doing it in good faith with no desire to cause damage, that you're supposed to be you're supposed to be
Yeah, I was
covered.
only
And it was
trying
in
to
an
help her.
emergency
Well, I guess I
situation,
ain't gonna get no money.
and you didn't provide anything above your amount of care.
Hey guys, we just showed you a skit of what you would do for providing care as a nurse. So that's a very important topic to all of us, I'm sure, because we're all going to be nurses really soon. And it's something that we're going to have to be thinking about because we go by accidents every day. You see people choking, all those things. And we thought it would be neat to break down what we're allowed to do and what we're protected under. So that's the skit we did. We talked about something called the Good Samaritan law. And we just wanted to go over the major nursing implications. So one of the major issues nurses have to consider is negligence. Negligence is a failure to provide care in a way that an equally person would provide care in a given situation. There are 4 criteria that must be met in order to prove negligence in court: a duty to act, a breach of duty to act, damages, and proximate cause. If one of these 4 requirements are not met, the healthcare provider will not be held liable in the lawsuit. So basically, all of those things have to happen for you to be able to be held liable. So if you're just stopping and, like in the skit we just did, we just performed basic Heimlich maneuver. Jessica was protected because that was something she was able to do under BLS. Now, if I had passed out and needed a trach or something and Jessica had done that, obviously that wouldn't be something she would be able to do, and then you can be held liable for that. So duty is an act. That's the one that's probably the most difficult to prove, because while you're working in a clinical setting, you clearly have to have a duty to act in that setting. If you're in the hospital and there's a code, you have to go to the code. But if you're going down the road, you don't necessarily have to do that if you just see an accident. So the difficulty in establishing a duty to act while not in a clinical setting is really hard. There is not a national standard in place requiring nurses to provide care in a medical situation while they are not being compensated. The laws vary from state to state on who is required to stop and what they are allowed to provide. The other 3 requirements are more cut and dry. A breach of duty to act is a failure to provide care, provide inappropriate care, or provide care beyond your level of training. Like I just talked about with Jessica, if she had done something that wasn't proper for being a nurse, something like BLS, that we could be held liable for that. So according to Brandy Clamp, a charge nurse in a level 2 trauma center, if a nurse decides to stop and provide care in a non-clinical setting, they can only provide care on their level of training and within their scope of practice. She also states that since medical care was provided outside of a clinical situation, that certain medical procedures that are normally within the nurse's scope of practice could not be performed due to lack of medical control. Damages and proximate cause go hand in hand. Damages are physical or psychological injuries sustained to a patient while the healthcare provider was administering care. Proximate cause states that the injury occurred or became worse due to the actions of the healthcare provider. So, those 4 things have to be proved in order for you to be sued or to be held criminally liable. If you're just providing care, basic CPR, basic Heimlich maneuver, you're always going to be safe. The Good Samaritan law states any person who is in good faith gratuitously renders emergency care at the scene of an accident or an emergency to the victim thereof shall not be liable for any civil damages for any personal injury as a result of any act of omission by such person rendering the emergency care or as a result of any act of a failure to act to provide or arrange for further medical treatment or for the injured person, except acts of omission that we just talked about amounting to gross negligence or willful or wanton misconduct. So this is the exact law on the books in South Carolina.
How about some questions you should ask before rendering aid?
All right, when we were addressed with the situation where we needed to perform the Heimlich maneuver, before we would actually go ahead and provide it, we need to be willing to ask ourselves, what does this person need? In this case, we saw that she was choking. We could visually see that she could not breathe. So we could evaluate that she needed the Heimlich maneuver. How much of an emergency is this? We have to breathe, point blank. So if she can't breathe within a certain amount of time, she's going to go unconscious and this is going to escalate. What do I have to offer? We all have our first aid, CPR, Heimlich maneuver certifications as a nurse. So we have the ability to offer quality care in those situations. It's basic life support. Is anyone already helping? In this scenario, Jessica was the first one on scene, the first one to be able to help the patient. So no one else was helping at this time, so she was the first there. Am I sufficiently educated and experienced to provide useful service to this person? Again, like I stated, being a nurse, you're required to keep your BLS certification up, which includes CPR, first aid, and the Heimlich maneuver. So you definitely have the education, and hopefully you've had the experience, whether it's been simulated or on real people. What is the potential for physical damage to myself? With the Heimlich maneuver, you should not be able to hurt yourself. There's always a chance of injury, but it should be minimal in this case. To yourself. What are the chances EMS will arrive here soon? With somebody who's choking, EMS can't just appear out of the air. Somebody's got no air circulating, you need to return their air supply as quickly as possible. The Heimlich maneuver is the easiest procedure to give somebody when they're choking, and it's the most important to return the air supply. So,
yeah, because on average, I think it takes like 8 to 10 minutes for an ambulance to get there on a good day. So if you don't help them right then, you're probably going to have a patient blue on the floor and possibly not going to be able to resuscitate them at that point. But we can always try.
And you risk brain damage, so we're wanting to prevent that. And that goes into what would be the likelihood EMS will arrive on time. They're going to get there as fast as they can, but if you already have the knowledge and the ability to help, you need to help.
Yes. Now, emergency statistics say estimated 1,255,000 heart attacks per year in the U.S. 350,000 die outside the hospital from a heart attack. An estimated 795,000 strokes per year in the U.S. There is one traffic collision every 3.7 minutes in South Carolina. That means you're probably going to pass a wreck on the way to work or school sometime this week. But you're covered under the Good Samaritan law if you need to get out and help. An estimated 6,000 people die per year from choking. Well, today she didn't die because we were able to save her. And we didn't have to perform CPR because we intervened in time because we knew we were protected.
And the thing about CPR is it's crazy. Only 1 out of 5 Americans are trained in CPR. Out of those 1 to 5 people, 70% of people are proven to do it incorrectly. That means only 30% of people are getting it right. So we wanted to include a video in this for you guys to just give you a refresher course for CPR. You should always be practicing your CPR, always keeping updated, because doing it once every 2 years is just not enough because you might not actually get the opportunity to do it. So always watching videos and taking the opportunity to practice is something that you need to do. Thank you for watching our video, and we hope you learned something.
Bye!
Bye.
In this video, I'm going to demonstrate how to administer CPR on an adult. Okay, suppose you find someone lying down on the floor. What are you going to do? First, assess the scene. Look around. Make sure the scene is safe. Are there safety hazards, a chemical spill, electrical wires, gas fumes, or anything dangerous? You can't help anyone if you become a victim too. If the scene is safe, check the person for a response. Tap or shake the victim on the shoulder and shout, "Are you okay?" If you do not get a response from the victim, yell for help. Next, tell a specific bystander to phone 911 or the emergency response number and get an AED, and very importantly, to come back to help. Many facilities, stores, schools, airports, conventions, and sports arenas will have AEDs available. Next, check the victim for breathing or only gasping. You need to scan the victim's body back and forth from head to abdomen for at least 5 seconds, but no more than 10 seconds. Agonal breathing sounds like gurgling or gasping. It is not breathing. You must start CPR. Now check for a pulse. To locate a carotid pulse on an adult or child, place your 2 fingers on the center of the victim's neck. Slide your fingers down the side of the neck into the notch between the muscles. You should feel a strong pulse there. If the victim has a pulse but is not breathing, give 1 rescue breath every 5 seconds. Then recheck the victim's pulse every 2 minutes. To perform a rescue breath, gently tilt the victim's forehead back with 1 hand, and with your other hand, lift the victim's chin. This position opens the airway. Pinch the nose closed and cover the victim's mouth with your mouth, breathing life-giving air into the victim. If you have a one-way mouth guard, use it as directed. The mouth guard has a one-way valve and protects the rescuer from contact with vomit, secretions, infectious fluids, etc. Place the elastic bands around the victim's ears to hold it in position. Give 2 rescue breaths, 1 second for each breath. Look for chest rise. If you don't see the chest rise, reposition if needed. If the victim has no pulse, start the CPR cycle of 30 compressions, 2 breaths, 30 compressions, 2 breaths, until help arrives or you can no longer perform effective CPR. Let me show you how to do this. First, if possible, remove clothing out of the way of the victim's chest. Next, locate your hand placement for compressions. With your hand, draw a line from armpit to center of chest for placement. Place the heel of one hand on the lower half of the sternum or breastbone. Now, place your other hand over the first, interlacing your fingers for support. With your arms straight and your shoulders positioned over the victim's chest, push down on the victim's chest. For an adult, you will want to push down at least 2 inches or 5 centimeters. Now watch as I perform 30 deep compressions in 18 seconds or less. You want to be able to give at least 100 compressions in a minute. You may lift your hands slightly off the chest between compressions to allow for full chest recoil. But keep your hand placement. Keep interruptions to a minimum. It helps to count out loud. Some say humming the tune to the 1980s pop tune Stayin' Alive is good for keeping the right tempo. I'll give 30 compressions in 18 seconds or less, counting out loud to 30. After 30 compressions, give 2 breaths. Look for the chest to rise between breaths. If there was no one available to help, after performing 5 cycles of CPR, call 911 and/or get an AED.